Hello, my name is Olivia Staples. I'm a nursing student at the University of South Alabama, and today I'll be performing the IV Saline lock checkoff. So she's going to scan the room. Upon entering the room, I'm going to perform hand hygiene. I'm going to verify hospital policy as well as the order. I'm going to identify my patient using two identifiers. I have the patient care order form and his armband. I see his name is Jaguar Jones. Jaguar Jones, date of birth 8/25/1963. 8/25/1963. I'm going to assess his allergies. Notice he has an allergy to penicillin and it is written on his armband. I'm going to gather all my equipment, have it all here. I'm going to explain the procedure as well as provide privacy. I'm going to make sure the trash can is where I need it, perform hand hygiene, and put on my goggles. Now, I'm going to raise the bed to a working height, lower the side rails, make sure the patient is comfortable and in supine or sitting position. And I'm going to be sure to maintain privacy throughout that. And I'm going to now open my packages using sterile technique. There we go. Okay. Now I'm going to get 3 pieces of tape. And now I'm going to clean the injection cap with the alcohol swab. I'm going to discard of that. And now I'm going to take my saline, remove the cap, and I'm going to prime it, making sure. Okay, so it's primed. I'm going to connect it. I'm going to prime it one more time. Put the cap on. Alright, now I'm going to loosen the cap, just so it's easier to remove later. Set that back in here. Now I'm going to remove my needle, put this aside, and get out my tighter. Now I'm going to tell you the 3 principles of selecting a vein. I'm going to make sure it's on the most distal part of the non-dominant hand. I would select a large and spongy vein, as well as make sure I'm not going over any bruises. And then the 3 principles for fostering the venous distension is I'm going to lightly stroke the vein. I am going to make sure that the extremity is dependent, and I would warm it to promote vasodilation. And now I'm going to put on the tourniquet. So I'm going to do this by I'm going to place this about 4 to 6 inches above where I plan to put the Okay, now I'm going to put, well, before I do that, I'm going to assess the appropriateness of the vein. I'm going to check the radial pulse of the patient. And now I'm going to put on my gloves. Put it on backwards. There we go. Okay. Now I'm going to move what I need closer to the patient. So I'm going to move this closer, and I'm actually going to flip it around. And now I'm going to begin cleaning. So I'm going to take the chlorhexidine and I would push in the wings to activate it, and I'm going to clean in horizontal, vertical motions, and circular motions for 30 seconds. And now I'm going to discard that, and I'm going to make sure that the area dries completely. And now I'm going to take my needle, and I'm going to anchor down the vein about 1.5 to 2 inches below where I'm planning to, and I'm going to make sure I don't go over where I just cleaned. So I'm going to anchor it by stretching the vein. I'm going to tell my patient to remain still and that they would feel a slight pinch, and I'm going to insert the needle with the bevel upwards at a 10 to 30 degree angle parallel to the vein. And once I see blood return, I will lower it and advance it 1/4 of an inch. Now I am going to advance the hub all the way in, making sure I do not take the needle in any further. And as soon as I advance it, I'm going to take and release the tourniquet. Now I'm going to apply pressure, and I'm going to gently remove the needle to the shards container, and I'm going to remove the tip and apply it to the hub. Now I'm going to hold it and apply tape. Temporary tape to very secure it. And after that, I am now going to take, I'm going to first aspirate for blood return, and then I'm going to, I would normally advance all of the saline into the IV, and while doing that, I'm going to be observing for swelling. I'm not going to be doing this today, so I'm just going to remove it and discard it into the container. Now I'm going to take my tegaderm. I'm going to remove the lining, and I'm going to place this all the way to the hub. And I'm going to gently remove the wrapper. Discarded that. Now that I've done this, I'm going to remove this tape. Discard that and secure it to the patient like so. So now I'm going to discard all my equipment. Remove my gloves, and I'm going to label. And I'm going to label the date, the time, the gauge, and my initials. And I'm going to place this on the edge of the dressing. And now I am going to instruct the patient. First, I am going to lower the bed. Before I do that, I'm going to lower the bed to a working height, raise the side rails, make sure the patient is comfortable and safe. I am going to now instruct the patient to the correct things if there is IV dislodging to prevent that, as well as signs and symptoms of IV complications. So this would be if there was infiltration, or if there was phlebitis as well as inflammation, and I would instruct the patient to let me know if it had stopped, if the fluid had stopped, or if it had slowed down, as well as if there was any bleeding in the dressing. And I'd also tell them to that they should secure it when they are moving, as well as to wrap it when they are about to shower. So now I am going to perform hand hygiene, and I'm going to document. I'm going to document the date, the time, the location, the number of attempts, as well as the catheter size, the gauge, how the patient tolerated the procedure, whether a saline lock was used, or flow rate, and the method of infusion. And now I'm going to begin discontinuing the IV. So I'm going to apply my gloves, and I already have my goggles on. I'm using a sepsis technique. Okay. So now I'm going to stabilize the catheter and remove the tegaderm, pulling towards the IV. I'm going to discard of that, and I'm going to remove the tape. Discard of that as well. And now I'm going to, normally that would not happen, but for the sake of video I'm going to continue, and I'm going to get a gauze, and I'm going to apply pressure, and I'm going to gently remove catheter, and I'm going to check the intactness of the tip. I'm going to discard that, and I would apply pressure for about 30 seconds. And now I'm going to tape the gauze to my patient. And I'm observing for any complications such as redness, tenderness, or swelling, or if there's any pain. And now I'm going to make sure that the patient is comfortable, that they are positioned safely, and that the bed is lowered to the lowest setting, the side rails are raised, the call light is in reach, and then I would go to the nursing station to document. And that concludes the checkoff. Thank you.